Hey, Pusino Pusinet, new little video. So, sorry about the voice. Got a little bit of a cold going on. Not the flu, the cold. And refer to my previous video to know. So, that's why I'm going to be drinking a little bit of tea with honey in it. So, the reason I'm doing this video is that there's not a lot of videos on YouTube talking about the subject I'll be discussing. Well, actually, no, let me rephrase that. There is a lot of videos on the topic, but not in the self-reliance medicine kind of community, which is kind of strange because, if you will, we had discussion about that in previous videos, that if you are in a situation of self-reliance, you will have to take care of patients. Well, if you look back in the beginning, or what's been constant through history, it's not so much about the medical part, but more what we call now nursing. So, beds, cleaning people, things like that. And not so much about giving medication, which is one part of it, but it's more the, because truly what we do in medicine is help heal, give tools for the body to heal himself. But then after that, you have to let the body heal. And this is why people stay in hospitals for 2 or 3 days, or even in intensive cares when we maintain their life, what we call life support, is because we have them on the breathing machine, and because they cannot do it by themselves. But we're not curing, as per se, the disease. We're giving help to the body so that the body can heal himself. So nursing, or nursing care, or whatever you want to call it, or care of a patient, becomes a very important component of it. And yet, a lot of the videos on self-reliance that we see about is on antibiotics, sutures, dressings, but we don't see a lot about, yeah, you do that, but what else? Because we're talking about 1 or 2, 3, or 4 weeks. Maybe the person will have to stay in bed for a month. Well, there's complication by that. Obviously, as it is a big topic, I won't be discussing all about it in one video, but I want to bring up some points and hopefully bring some reference. Like we discussed in the past, is having a nursing book. Those books are mandatory in most of the programs in nursing, and they're paying to buy because they're pretty expensive. Some of them go like to $100, $150 a book. Well, when you have to buy like 6, 7, or 10 of them through your nursing, it becomes pretty expensive. But the good thing, if you go Amazon, eBay, things like that, a lot of the nursing, after you finish with this, it's pretty much not useless, but not much of a use. So, I don't remember how much I bought that one, but I bought it on eBay for, because again, it's been a long time I didn't review the basics, so sometime on some of my videos I wanted to review like giving a bath and things like that, because in emergency I don't give much baths. But I wanted to review some techniques and see what's up to date about it. And I bought this one, and as you can see, there's a DVD with it, and it's not even open, and there's like a code for, I guess, for internet and stuff, and it's not even been scratched. And I don't remember how much I paid, but it was like, I think 20 or 40 bucks. It was under $100 for sure. So a book like this can be very, very useful in your library. Again, because of this, the basic of what we're going to be talking about. So in the basic of stuff that we're talking about, is, here I got a good one here. As you can see, something as simple as how you get someone out of the bed, or how to change sheet in someone that is in the bed. Sounds basic, but if you have someone that is sick and cannot mobilize very well, I mean, if you look at the program of nursing, this kind of stuff takes about the first year of it. It's pretty much, we learned other stuff as well, but pretty much for the first year, it's about how to learn that stuff. Or mastering, I should say. But it is a very important component of it. And we're talking about changing sheet, putting people from a bed to a chair, and how to protect your back with it. And even some hospitals, even when you're fully licensed and everything, they'll make you, they'll have a mandatory course on how to make sure that you protect your back, because if you hurt your back, your career is not over, but you get a lot of problem after that, because there's a lot of heavy lifting. But there's good techniques to use. And bedpans looks strange, but there's ways of turning patient to put people on bedpans. Crutches, how to measure the good time of crutches. So all those topics that I'm enumerating right now are not discussed a lot, but yet they will be important, because if you have someone that has even just the flu, let's say someone with bad flu, like feeling like crap, cannot move, or like, pain everywhere and everything, or broke his leg. Let's take a broken leg, so that makes more sense. So let's say I have someone with a broken femur. You did what we'll discuss a little bit in your videos and stuff, and great. So now this person is immobilized and has a broken leg. Well, cannot really walk on his own, and the pain will be pretty bad, and depending on how much supplies you were able to get, maybe the pain control won't be that great. Well, now, if you leave this person that has this broken leg, so it's a simple broken leg, well, if you leave it in bed too long, there's a place where we call pressure points. So that means that, for example, your coccyx. So if imagine that you're on this surface, so in laying in the bed, there's a place where your bone and your skin will kind of, your bone is coming out more because of the plane surface, because we're not like flat. We're more like, we have like a certain structure, and those places will put pressure points. Well, if you leave someone too long on a surface like this, they may develop what we call bed sores. And bed sores means that basically it's big injuries where the bone has push on the skin and break the skin, and then you can get like very bad one. Like, there's some place where if you have them in the coccyx, you can literally put your fist in it. So in your coccyx, which is the back of the top of your buttock, you can literally put your fist on it. That's how big the wound can become. So it's really important to turn the people. But there's a way of doing it, again, to protect your back, and also for people so that they don't suffer too much. So that's one of them. The next thing, this person now that is in the bed, if you immobilize them too long, so that means that they stay in bed, don't move, well, now they can have complication with their lungs, because if they don't move, one thing that can happen is that as we move and breathe and do exercise, we clear all that mucus that we accumulate in our lungs. But if you don't do that, we get a complication called atelectasis, which is kind of mucus that plugs those alveoli, and or the worst, you can even have a pneumonia. Another complication that you can have, our venous return of our blood is basically blood that comes back is when we walk. So that means our muscle So when it gets out of her heart, for arteries, the heart push it. It goes all around the body. But for the venous, there's no muscles. There's no contraction. So what they use is their own muscles to push that blood up all the way back. Well, if you don't walk, that blood stays stagnant right there in your veins. And what it can create is clots. And so if you create clots, then you can have complications like what we call a DVT, deep venous thrombosis, or even worse, you can have a pulmonary embolism from that. Basically, like what happens is that the clot goes and then go all the way up to the lungs, because the lungs is a big filter of the venous return, and it clogs, and basically now you have someone with a PE. Another thing too is that because you don't do much exercise, like when I broke my leg, I was in a cast for about 4 or 5 weeks. Well, when the cast came out, my right leg versus my left leg was way different. So it's really important to do exercise. There's some exercise to keep those muscles going, or else you're going to waste your muscle mass. So all those things are really important, and we're just talking about a fractured leg here. We're not talking about worse injuries or anything like that. Even just peeing. So now you have someone with a broken leg. Well, are you going to let them get up all the time to go again to increase their pains? So it's all decisions that you have to take. And that's why I don't quite understand why it's not a bigger topic on the self-reliance community, because it will be something you will have to do. So maybe you'll never have to give antibiotic, maybe you'll never have a pneumonia, maybe you will never have to do pretty much nothing to pay. But every time that you'll have a sick patient, you will, or a sick person I should say, every time you will have this, you will have to do something from basic nursing, meaning like to transfer them from a chair to something. You will have to change their sheet, you will have to maybe even bake them, you will have to urine, stools, because we all have to do that on a basic, on a constant time. So all those basic needs that we have, they become pretty important when you have this. So I'll encourage you. Basically, this was the point of this video, was to encourage you to do research, to actually buy something like this, because obviously I cannot teach all from this book in one video. But if people are interested in certain techniques and they want to, I can just PM me and I'll do it. But otherwise, what I really encourage you is look internet, look at YouTube, buy a book like this. Especially, I would buy especially a book like this, because there's maybe things that you want, and they're not that expensive. And if you do that, if you look, and I'll put a link on stuff that you can see. Just start questioning yourself of what would I need more in your preparation as well. What else would I need so that I'd be prepared for having someone that stay in the bed for a long period of time. Anyway, hopefully that video was brought you to think a little bit more, and I'll talk to you soon.